Yeah, great question, and thank you. I think digital twins and this idea of assembling unstructured data in a way that allows us to make decisions clinically is a very evolving and growing field. Obviously it seems a little bit space age to be able to turn everything over to a machine to make these decisions. But what we've done in just a very few limited cases at Sumitomo Pharma is we've taken all of the data we've generated within a clinical study. So this can be everything from efficacy to PK data, patient information that would be appropriate. And then even in addition to that, we take all of our preclinical data, which is really kind of where my area of expertise is. So all the data we generated through our animal models in the lab preclinically. And again, that can be efficacy. It can be any kind of information about, drug-drug interactions. It literally can be any kind of information. And this gets plugged into an artificial intelligence model, and it literally builds a digital twin for each patient in your study, or even theoretically future patients that you might treat that you haven't yet treated. And it allows you to run these simulations. And so we've partnered with various companies. This isn't a technology that we necessarily have fully in-house, but we can work with these companies to run these simulations and have been able to ask some finite questions that have helped us to make decisions moving forward. Yeah, great question. And, we do feel like we're in kind of a unique situation to test this out with myelofibrosis because total symptom score has been a very meaningful endpoint and in fact a regulatory endpoint for new agents in myelofibrosis. But generally in oncology studies, quality of life or things like that have been a bit more challenging with the agency. Obviously they want survival or other, real hard and fast endpoints. And so it's a great question that I don't know if we know where that boundary exists. I think our focus is to see whether we can use it in this space, whether it's helpful, even if it's just helpful for us to understand internally, maybe how the compound is affecting quality of life or the symptom score, whether we can use that with health agencies. We don't know. It's not something that we're proposing at this time. It's just very exploratory and something we're excited about and kind of excited to see where it goes. But it's a great question to then challenge ourselves to think, okay, it actually did work here, if it does. And, would there be other indications? Could we broaden this into, larger patient populations or across other tumor types? I don't have the answer to that question at this time. I can't speak too specifically, but just from a general sense, you can put very finite boundaries. The device may be capable of measuring dozens and dozens of data points, where maybe only a few of them are what we're really interested in or what we have are focused on. And so kind of really just setting those boundaries from a digital perspective or limiting the type of device. You don't need a full functional Fitbit if there's only a couple things that you're interested, like steps or something like that, sleep, so on, just general activity. And so I think just putting those boundaries around it is very important and obviously something that we're focused on from the patient perspective, but then also, we don't want to be collecting data that's not helpful to us. Yeah, so Sumitomo Pharma obviously is a Japanese-based company, although we do have a presence here in the US. It's called Sumitomo Pharma America here in the US, Sumitomo Pharma back in Japan. Sumitomo Pharma has actually been in business for hundreds of years as a pharma company. Most recently, over the last couple decades, they've largely been in the psychiatric and the CNS disorder space. And it's really kind of what's allowed them to build as a pharma company. But they've really made a concerted effort over the last 5 to 10 years to become a specialty player in the oncology space. And so we have one drug approved that's a prostate cancer drug. It's an androgen deprivation therapy that is used in prostate cancer. That's really exciting. And then we have 3 agents that are in clinical development. 2 are in heme malignancies. I mentioned myelofibrosis is one of them. We also have an acute leukemia drug that is in a phase 2, and then an agent that targets DNA damage repair that's in a phase 1 trial in solid tumors. So we're pushing hard into the oncology space, building off of our one approval in prostate cancer, and really have the goal of having a strong presence in the oncology space.